resident doctors have decided to shelve that protest as they had had a conversation with the federal government and as well as the Nigeria Medical Association, that is the umbrella body for, for medical doctors, and they agreed to wait on government to see, to understand with the position of government as it is right now, but they are hoping that there would be a resolution reached, a speedy resolution reached in no distant time to addressing this age-long dispute with regards to the demands of resident doctors, some of which have to do with the replacement of their colleagues that have left the country. And they have also spoken about their trainings, which they have said government needs to look into, and some other issues that they have been demanding from government over the years. And we hope that now that there has been the approval of ministerial nominees, which according to reports, there will be that the president will be swearing them in sometime later this week, according to reports, that there will be speedy action taken with regards to the demand of resident doctors in no distant time.
It is a good sign, what we see now, that after the meeting between the federal government and the medical doctors, the striking medical doctors, it's even good enough that, you know, despite the stance from both sides, especially the striking doctors, that the channel of communication hadn't, you know, broken down. And so from what we see yesterday, the meeting held, we've seen the positions of both sides. And now, you know, waking up to hear the news that the much talked about and planned doctors' protests, you know, at
resident
strategic,
doctors' protests.
Yeah, indeed, at strategic places, structures across the country. Yes. It's good to know that that protest will not be holding, albeit the doctors have said it will only be for a few days, in about 5 or 7 days, which should lapse by next week. So these days left are crucial. This window offered to the federal government, and indeed, you know, the striking doctors are indeed crucial. But of course, the ultimate desire of everyone is for that the doctors, the striking resident doctors, return back to the hospitals and save lives as is their mandate, you know, professionally. So it's a good sign, and we hope that, you know, the next thing, there will still be more channels of communication, of dialoguing, which should, and we hope it will, you know, make progress. It will at least get to an encouraging point for everyone, which will lead to the strike being called off.
But some Nigerians have, you know, come down hard on the resident doctors, saying that, you know, initially the resident doctors had said that there was no going back with regards to this protest that they intended, peaceful protest that they intended to begin today. And they were saying it is to press home their points and demands for the government to understand what it is. They have said that government has taken them for granted for quite some time now. And so this was the opportunity they were ready to take for government to understand how crucial their demands were. And so some Nigerians have said, this is the opportunity you had to press home your demands. And now you have said, you're saying that you are calling off this protest, not the strike, but the protest, because you said you have engaged government and you are willing to hold off to see what government will do at this point. And so this criticism, I believe that Nigerians have to just allow things as it is. Let's see if beyond the calling of the protest, they decide to call off the strike, because there are patients in the hospital who are bearing the brunt of the decisions taking now, and the government will look into the matters of their demands speedily. Like we mentioned earlier this week, if they are talking about the replacement of their counterparts who have left the country because of the pressure of work for them, 5,000 patients to a doctor, as it is being said or being reported. I think that whatever the processes are with regards to replacements, those are the low-hanging fruits that the government can begin to look into, to addressing these matters, such that these persons can begin to get some relief and believe that government is ready and willing to take some steps.